All right, everyone. I just want to say thank you for having me. My name is Jessica Preheim, and I am the Vice President of Strategic Planning at the Coalition. Been with the Coalition for a little over a year, but I have been working with Search for probably about 11 or 12 years now in Houston. So it's been a long partnership over the years, and I'm excited to be here today. So what I wanted to dive into was a little bit of how we developed what we call CHIP, which is the community-wide COVID-19 housing program. It's a lot to say, so we do call it CHIP. Let's see, when the pandemic first started, we really had to, kind of respond to the emergencies in front of us. So for the first month during the pandemic, we were thinking about quarantine and isolation facilities for people who are experiencing homelessness to recover. We were thinking about vaccination programs, really making sure that people on the streets were educated, that outreach teams had proper PPE. We were really responding to the emergency in front of us. And then we kind of stepped back. So many cities in the US, that has continued to be their response. It's really responding to that emergency in front of them. What we did is we kind of stepped and we said, what resources are coming into our community because of the pandemic? So we thought there's FEMA resources, there's CARES Treasury resources, there's Emergency Solutions Grants, which is ESG. I always use a lot of acronyms and I apologize. But ESG is homeless specific funding. And then CDBG, which is community development block grants. Again, it can be used for bricks and sticks to build properties, but it can also be used for homeless services. And we had, again, another acronym, HOME TBRA. HOME is again a funding source that can be used to build an apartment complex, or it can be used for rental assistance. So it's another source that was coming into our community. And then we looked at kind of private resources and philanthropic resources that were coming into our community. And we said that there's probably around $50 to $75 million that is going to be invested into homelessness in some way. It's going to be invested to provide a bandage to the emergency, or it could be shifted to think about a long-term impact and a long-term investment if we could do things differently. With that, we kind of looked at our need in our community. As Alexis said, we have a gap in rapid rehousing. We had done a system analysis and realized that we needed, well over 1,000 additional units of permanent rapid rehousing within our system, including some additional permanent supportive housing. So we're like, okay, we have a need, we have resources in front of us. So now what should we do? So we kind of stepped back, went to our city and county partners and had many meetings to think through some permanent investments into homelessness, or investments into homelessness. I will say many of these resources are time limited, so I'll get into that. But we said, how can we have the biggest impact possible and really just keep the mantra going that housing is healthcare in a pandemic? The homelessness was a major health concern for the people experiencing homelessness and for the people who respond to homelessness well before the pandemic. But this really highlighted that housing is healthcare. It is not just, it is an appropriate response to keep people safe. People who are homeless, once you get sick from COVID, you're more likely to be hospitalized and receive critical care, and you're more likely to die without a home. So how can we provide that housing? So with that, we got the commitment from the city and the county and our philanthropic partners to stand up a $65 million rehousing program to house 5,000 individuals by September of 2022. And again, this is just a little bit of the breakdown. The city of Houston put in about 39 million. Harris County, 18 million, and we are raising the remaining $8 million from philanthropic resources and partners with our community. We've raised about 6 million so far. So our strategy is the one we're here to talk about rapid rehousing. Rapid rehousing is one of our largest strategies that we wanted to stand up in this. Because of the time limited nature of a lot of the COVID related resources that are coming into our community, we had to think about how could we stand up programs that will give people the platform and the services and the rental subsidy, that three-legged stool that Alexis was talking about, to regain their stability. And then at the end of these resources, they've been supported so they can sustain and not return to homelessness. So with rapid rehousing, with the temporary nature, it was a perfect fit. We thought we can do a rapid rehousing program. We targeted 1,700 units, we wanted to serve 1,700 households in rapid rehousing. And this really was a 12-month lease with those supportive services that, Search does so well, and we'll talk about, but really, how do we wrap around support? So not only do people it's not just a roof over their head, but it's the subsidy and the services. So at the end of the financial assistance, they're really able to maintain their stability for the long term. And then we added on a few other additional resources. So we are standing up a diversion program, which is really trying to make sure that people don't come into our homeless system. Again, the permanent supportive housing, we're fast tracking our permanent supportive housing. And we're there's increased outreach within our community, mental health, case management. So there's other components that go into this CHIP program. Again, we want to serve 1,700 individuals and households in rapid rehousing. Search is serving 150 of those individuals, in addition to other rapid rehousing that Search already does. So I do want to say that Search does more than just this 150. We have existing rapid rehousing programs, and Search plays a very large role in those programs as well. So we're kind of working with the new rapid rehousing and this new infusion of resources rapid rehousing. We also are going to serve 1,000 people in that permanent supportive housing. So really that long-term subsidy and long-term supports for people with very high barriers. And then 2,000 individuals in this diversion. So making sure that we can do everything we can to have someone never enter our homeless system. We know that once you're in the homeless system, it's very challenging to get out of the homeless system. So with that, so far, we pulled this, I believe, this Monday. So these numbers have actually increased. What you can see here is the thin, dark green line on the bottom. This is where we would be housing people as a system with CHIP wasn't in the mix. So you can see this orange line, we have housed 1,188 individuals so far in CHIP. So we've really been able to triple our housing capacity as a system. And this is since October of 2020. What you can see this gray line is, these are all the people that are searching for a unit. So we hope to be on track here in March to meeting our goals of housing 5,000 individuals. For rapid rehousing specifically, I think you can really see the dramatic increase of how rapid has helped our system. Again, that really light green line on the bottom is where we would be if we didn't have this infusion of resources. And the orange of the 642 individuals is who we've been able to house since we started this project. And again, the gray is people that are out searching for a unit and will be housed very shortly. So we've really been able to do a lot to increase it. Again, this is just another way to show it. We, in October, when we first started this, and I would say actually even before, before we started this, our housing turnover for rapid rehousing went anywhere from 17 to 30 people we were able to house a month in rapid rehousing. And you can look in January, we were able to increase that to 224 individuals in rapid rehousing. So this infusion of resources has really allowed us to house a lot more individuals. February will go up. Again, we pulled this mid-month, so that's why you see February is a little lower, but it will catch up. Another really significant benefit is we're housing people faster. Before we started CHIP for rapid rehousing, it took us about 2 months to get someone housed. And actually, this is leading the nation. HUD's benchmark to get someone into housing is actually 90 days. So we were actually ahead of the targets established by HUD. But now that we've started CHIP, we are down to 32 days as the average time it takes to get someone housed. So there's a lot of other benefits. And also just wanted to note that permanent supportive housing used to take about 80 days to get someone housed, and it's down to 34 days. So this is really another benefit is we're getting people housed, and we're getting people housed in a much faster way. And again, I think that is my last slide. And I will turn it over to Alexis.